Very good afternoon. Before starting the session, I'd like you to show a documentary based on telemedicine.
उर्मी,
हाँ।
लो
अरे
चाय पिलाओ,
तो ऐसे कोई
गर्मा
हाथ में नहीं पकड़ सकते।
लल्ली, अरे लल्ली दिखाई ना दे रही कहीं?
पढ़ने गई है।
ये अच्छा है, लो चाय।
देखो गरम है।
हाँ गर्मा गर्म। उर्मी, अपनी लल्ली ने 12वीं पास तो कर ली है, आगे क्या करने से कुछ सोचा है?
वो कह रही थी कि शहर जाकर के ना आगे की पढ़ाई करेगी।
पढ़ाई,
डॉक्टर बनना चाहती है।
डॉक्टर। यो अच्छा है, डॉक्टर बन के तुम्हारा और हमारा इलाज मुफ्त कर लेगी।
अरे
लेकिन डॉक्टर की पढ़ाई बड़ी कैडी हो गए।
हाँ तो ठीक है ना, ट्यूशन लगा लेगी और का।
हाँ जो ठीक है। हम राम भैया से बात करते हैं ट्यूशन की।
नंबर है?
हाँ दिया तो एक बार।
घुमा तो नहीं दियो? का हुआ? ए अनु के पापा का हुआ? अनु के पापा का हुआ? अरे ठीक तो? अरे कोई है अनु? अरे टीकम, अरे कोई है का? अरे कोई तो और है। अरे कौन है का? डॉक्टर साहब ठीक है ना? वो क्या हुआ?
अब घबराइए नहीं, वो बिल्कुल ठीक है। प्लीज मेरे साथ आइए। बैठिए। देखिए अभी वो खतरे से बिल्कुल बाहर है और ठीक भी है।
लेकिन डॉक्टर साहब हुआ क्या है उन्हें? उन्हें तो कोई बीमारी भी नहीं है।
उन्हें हार्ट अटैक पड़ा है।
जी हार्ट अटैक? लेकिन वो उन्हें कभी कोई दिक्कत नहीं हुई और वो बहुत अच्छे से हमारे साथ सुबह चाय पी रहे थे, ऐसा कैसे हो गया?
देखिए शुगर और ब्लड प्रेशर की बीमारी उन्हें काफी दिनों से थी, जिसकी सही समय पर जांच हो जानी चाहिए थी और जिसके चलते ही उन्हें ये दिल का दौरा पड़ा है।
लेकिन डॉक्टर साहब ऐसा कैसे हो सकता है?
देखिए इन बीमारियों का पता तभी चलता है जब सही समय पर सही जांच हो। अब सही समय पर सही जांच ना होने से इनकी बीमारी बढ़ चुकी है और इनके दिल की खून की 2 नलियां ब्लॉक हो चुकी हैं, जिसके लिए हमें स्टेंट डालना पड़ेगा। और हाँ, 1.5 से 2 लाख रुपए का खर्चा भी आएगा।
डॉक्टर साहब अब मैं समझी। आशा दीदी क्यों मुझे और इन्हें जांच कराने के लिए कहती थी।
घबराइए नहीं, लेकिन आगे से ध्यान रखिए और लोगों को भी समझाइए कि सही समय पर जांच कराने से न सिर्फ बीमारी का पता चलता है, बल्कि उसकी रोकथाम भी जल्दी हो जाती है। और हाँ, वो कोई भयानक रूप नहीं ले पाती।
In India, every year, nearly 58 lakh people die from non-communicable diseases comprising heart and lung diseases, stroke, cancer, and diabetes. In other words, 1 in 4 Indians has a risk of dying from an NCD before they reach the age of 70. According to World Health Organization projections, the total annual number of deaths from NCDs will increase to 5,50,000 by 2030 if timely interventions are not done for prevention and control of NCDs. Estimates suggest that the NCDs in India account for an economic burden in the range of 5 to 10% of GDP, which is significant and slowing down GDP, thus hampering development. WHO acknowledges that digital health interventions facilitate universal healthcare coverage while promoting quality healthcare. According to Bain & Company's 2019 Asia Pacific Frontline Healthcare Survey, 40% of the consumers would use telemedicine services in future. 45% will depend on online pharmacy services and 91% of consumers would use digital health services. Therefore, the need of the hour is to promote digital health platforms like telehealth that can help people with NCDs by screening and providing teleconsultations instantly at their doorstep. The telehealth's mission is to speed up the Government of India's vision of Ayushman Bharat by creating affordable, accessible, and quality healthcare service delivery system. This model of service delivery shall ensure timely screening, diagnosis, treatment, and referral for NCDs, MCH services, rare diseases, and many more through telemedicine. Supplements the government policies and programs. Provides a technology and cloud-based platform for automated electronic data entry and management. Locally based physicians, both in public and private sectors, get supportive supervision and guidance from specialists sitting at district hospital and tertiary care. Reduces time taken for emergencies and helps the doctor to quickly initiate the right treatment with readily available medical investigation results. Now, let's see how it works. Suppose a rural patient faces some issues. She or he visits health center and gets tested through telehealth. The results are instantly uploaded on telehealth cloud database, which connects to a specialist who reverts back with a treatment plan. Other significant features are automated health screening and diagnostics, live video consultation with reputed doctors and let's now hear from the health experts themselves on what they have to say about this intervention.
Very good innovations, and telemedicine is one of the good innovations which has come out of it. And the healthcare system in the country as well as maybe in the world also, because during this pandemic, this started as a budding field now, which has become very much, it has become improved, and it is giving great benefit to the patients.
Telehealth is use of digital information and communication technology like computers and mobiles for providing healthcare to the patients. There has been a gradual revolution in telemedicine and telehealth in providing quality patient care. It's a win-win situation for both patients as well as doctors.
Suppose I see 20 patients in a village, remote village of our country on telemedicine. Out of these, 10 will not need to come. I can just give them quality care at their home only. Even the patient who need to come to us, I can order them, I can advise them tests, and this will greatly reduce their need to stay in the institute. Okay, the third major advantage is follow-up of the patients. Suppose 80% of our patients just need to be given same treatment and they keep on visiting us unnecessarily. This telemedicine has a great potential to reduce their visits to the institute and will reduce our rush also.
In the facility, we can have consultations with super specialties, as well as we can have tests which can be done at the local level, which can be transmitted automatically to the concerned physician or the super specialties for the diagnosis and treatment at the local level without actually visiting the peripheral hospital.
CIBioD healthcare system is an innovative idea to provide healthcare systems in remote and inaccessible areas. This system will give a battery of tests, and it has more than around 60 tests can be done at a time. It will also provide the expert opinion at the point of care, and I believe this will help to diagnose the disease in earlier stage and helps to reduce many deaths.
We, like at PGI, used to face a lot of rush, huge crowds in our outpatient department. Now with the advent of telemedicine, this number of patients coming to institutes will come down, and the patients who actually need the institute care will be traveling, and this will enable us to provide quality care to those patients.
एक ऐसा मशीन है कि आप उसमें कोई सा भी टेस्ट करवाना चाहेंगे तो उसमें आपका हो जाएगा टेस्ट। उसमें आपको कहीं भी आना जाना नहीं पड़ेगा, कहीं पे आपको आने जाने के लिए करते हैं, इधर उधर भाग दौड़ करते हैं, आप काम करने वाले बंदे हैं, तो इसमें आपका एक दिन में हर चीज़ टेस्ट हो जाएगा। आप कोई सा भी टेस्ट करवाना चाहें तो इसमें आपका हो जाएगा।
मैं अपने फादर मदर का टेस्ट करवाने यहाँ आया था, तो साथ में हेल्थ केयर मशीन पे मैंने भी अपना टेस्ट करवा लिया। वैसे तो मैं बिल्कुल फिट हूँ, मुझे लगता ही नहीं मेरे अंदर कोई प्रॉब्लम है,
लेकिन जब मेरी रिपोर्ट्स आई और जब मेरी स्क्रीनिंग हुई तो मुझे पता लगा कि मेरा बीपी बढ़ा हुआ है, मेरी रिपोर्ट्स अप डाउन हो रही हैं। तो उसके बाद मैंने डॉक्टर के साथ टेली कंसल्टेशंस की, तो उसके बाद मुझे पता लगा कि मुझे क्या क्या प्रॉब्लम्स हैं, तो उन्होंने मुझे कोई रिकमेंडेशन।
As we all know that last 2 years were very tough time for the entire humanity, especially for the chronic patients. All the hospitals were out of bound, out of reach due to the fear of COVID, and the entire medical fraternity was fighting with the unforeseen enemy. But during this tough period, we at Center for Innovation and Biodesign, we were trying to contribute a little bit by developing the telemedicine into a full-fledged domain to serve the patients in the remote areas, in the rural areas, for making healthcare accessible, affordable for each and everyone in every corner of the globe.
This intervention will be a significant step towards prevention of NCDs. It will help in saving lives of millions of people and address the issues related to access.
Where all the tests can be done with instant reporting and all the data is stored at cloud, and hence all the EMR is protected for the rural masses, making a big leap in the provision of the healthcare services in the rural people, bringing down the need of travel for availing the consultation of a specialist in district hospital and for getting the test done. Hence, we brought down the carbon emission from the medical travel as well as the cost of the medical consultation by many fold.
मैं अपनी वाइफ के साथ उसके बर्थडे पे मार्केट घूमने गया था, वहाँ पे मैंने टेली हेल्थ कियोस्क देखा। सो मैंने एकदम मेरे माइंड में आया कि भाई इसको बर्थडे प्रेजेंट मैं इस बार टेली हेल्थ का कूपन दूं। सो उसको टेली हेल्थ का कूपन दिया, उसने सारे वहाँ पे कियोस्क पे टेस्ट करवाए जो बेसिक मैंडेटरी टेस्ट हैं 50 के आसपास, और उसके कारण हमें उसको मेरी वाइफ को कैसे और बेटर रहना है, उसकी वेलनेस के लिए हमें एरियाज ऑफ इम्प्रूवमेंट पता चले जो शायद लेटर स्टेज पे जाके कहीं ना कहीं पे किसी सीरियस प्रॉब्लम में लीड कर सकते थे। तो हम लोगों ने उस सीरियस प्रॉब्लम को पहली स्टेज पे ही, प्रिवेंटिव स्टेज पे ही अवॉइड कर दिया इस हेल्थ कूपन के कारण जो टेलीमेडिसिन कियोस्क पे अवेलेबल था।
This is my request to all the medical fraternity, to the pharma fraternity, to support this endeavor to make it a reality, to take our country into the next level of healthcare, that is digital health via the telemedicine, by making this dream a real happening.
Thank you everyone for watching the documentary. This is an initiative by CIBioD. I now welcome all of you to the third session of our fourth day of Tech4Seva events, Biomedical Waste Management, Let's Save the Nature. Now I invite Dr. Sakshi for a formal welcome.
Namaskar, good afternoon to one and all. It's my great pleasure to heartily welcome our guests and audience to Day 3 second session being organized under the umbrella of Tech4Seva. This event is jointly being hosted by Vigyan Bharati, Unnat Bharat Abhiyan, and Center for Innovation and Biodesign. We are fortunate to have Shri Virendra Kumar Kamarji, our chief guest, our special guest Dr. Jaspal Singh, Dr. Karamjit Singh, our presiding guest Dr. Zora Singh, our esteemed panelists Dr. J.S. Thakur, Dr. Nivedita, Dr. Gopal Pathak, our awardees, and all those who have joined us online. As we all know, biomedical waste is generated during the diagnosis, treatment, or immunization of human beings or animals, or in research activities pertaining thereto, or in the production or testing of biologicals, etc. So biomedical waste poses various health and environmental hazards, and this is the wider challenge that the pandemic has posed before us. Various Government of India committees are working to ensure compliance to waste management facilities in the country. We look forward to make this vision a reality and to thus ensure India's leadership to prevent diseases and response at a global level. So I welcome you all to this session, and now let's begin with the session.
I take this opportunity to introduce our worthy chief guest, Shri Virender Kanwarji, Minister of Rural Development, Panchayati Raj, Agriculture, Animal Husbandry and Fisheries. He's an Indian politician elected to the Himachal Pradesh Legislative Assembly. He's the member of Bharatiya Janata Party. He is Minister of Rural Development, Panchayati Raj, Agriculture, Animal Husbandry and Fisheries in Jai Ram Thakur Cabinet. He established Kamdenu Manav Seva Trust for sheltering stray animals. He awared masses for the preservation of environment and tree plantation and organizing blood donation camps. We are very grateful to have you as our chief guest, sir. Sir would be joining us very shortly, so we will have his speech little later. Thank you. I would now like to welcome and introduce our presiding guest, Dr. Zora Singh, Chancellor, Desh Bhagat University. Dr. Zora Singh, MBBS, DCH, is the Chancellor of Desh Bhagat University and the former President of the Indian Medical Association's Chandigarh State Branch. He is the member of Rotary Club Chandigarh. He is the think tank for Master Plan of LPA Shri Muktsar Sahib. He is the member of Chandigarh Press Club. He served as the governing body of NRHM and the Chandigarh administration. He was bestowed with the President's Appreciation Award, Rashtriya Ratna Award, Shiksha Bharati Puraskar, Ambassador for Peace Award, Bharat Vibhushan Ratna Award, Punjab Ratna Award, and many more. We welcome our presiding guest, Dr. Zora Singh. He will also be joining us very shortly. Thank you. Our next worthy special guest, Dr. Karamjeet Singh, Vice Chancellor, GND, SOU. He's the Professor in Finance and Strategic Management, University Business School, Punjab University, Chandigarh. He's presently working as Registrar, Punjab University, and being a syndicate member of the university. Worked on various administrative posts in the university and remained as member of UGC Expert Committee. He's also the former President of Indian Accounting Association. He's a PU Fellow for 8 years and a syndicate member for 3 terms. Member in number of committees of UGC and NAC. He was awarded Best Business Academic Award by the Indian Commerce Association in a Jaipur University. We are really grateful to have him as our special guest. He will also be joining us. So I would like to invite Dr. Karamjeet Singh to kindly please motivate us with his inspirational words. Thank you, sir.
Thank you. I'm really grateful to Dr. Virender Garg for providing me an opportunity to participate in this international summit and organized by Vigyan Bharati, Unnat Bharat Abhiyan and Center for Innovation and Biodesign, PGI. I could see my colleagues, Dr. Harish and Dr. Sakshi, here in the conference. And I'm very happy that this initiative is taken by the PGI and of course by the faculty of Punjab University also. Today is the 4th day, I was told that, and I must appreciate that a galaxy of eminent scholars must have shared their valuable thoughts with the illustrious audience also. Now, I was asked by Dr. Virender Garg to give my, thought or taking into account the clues from Guru Granth Sahib. Since topic is very important, that is biomedical waste management, and the idea is you have to save the nature. Now, I am not from medical profession, but as a layman, I have strong conviction that we should have respect for our natural resources. And this is what our religious scriptures taught us. Now, if I share my opinion with you, that in the starting pages of Guru Granth Sahib, importance is given to vital natural resources which come to us as bounties from Lord God. They are free of any charge and which requires care to use them very judicially. Air, water, heat, space are invaluable for human living. Without air, the human existence can't sustain for more than a minute. Without water and the sun, the entity of human life cannot be contemplated at all. So is the case with earth. Keeping their vital role in human sustenance, Gurbani values air as guru. The water is eulogized as the father, and the earth occupies the holy place of the mother. Day and night are the nurses in whose lap the whole creation fondles. To quote a Bani from Guru Nanak Sahib, Pavan Guru, Pani Pita, Mata Tartam Hat, Divas Rat Duidai Daya, Khele Sagal Jagat. The Bani is self-explanatory. That is, air is vital force, water the progenitor, the vast earth is the mother of all, and day and night are nurses fondling all creation in their lap. Friends, realizing that air and water give us life and help the growth process of every vegetation and inmate living, we should be very careful in utilizing these important resources wisely and optimally, and avoid polluting and wasting them for our personal gain and vested interest. At present, the people throughout the world are not very serious in using these bounties carefully. If the present trend of exploiting these resources continues unchecked, very soon, world habitat would be facing a total famine of usable water, which is normally, what activity we are doing, whatever biowaste we are creating, we need to be considered to exploit these resources and save them from the progeny. I am just saying that what we are doing it. This technology is very fine. I could see the small video which is presented before the start of the session. I could see that you see that we should be very, technology is fine. As informed, but that during this COVID period also, technology is at the same time where we have to dump our wastage also. That is very, very important, because we should be very careful. Gurbani says, Dudh bin tan, Pankh bin pankhi, Jal bin utpaj kam nahi. You see, tan means cow. As the cow without milk, the bird without wings are worthless, so the vegetation without water is of little origin. Why I am saying this thing, that for medical people particularly, that where to, dump their wastages, that is something very, very important. We should see that our water should not be polluted. Again, since water is the most important ingredient to sustain life, so we say that Pehla pani jo hai, jit harya sab hoy. You see that first of living, what is very, that God is merciful, who cares to maintain the vital supplies for us and sends us water in the form of rain. It is therefore imperative on our part not to pollute and misuse these otherwise expensive natural resources. Again, let me quote one very important stanza. Okay, even water, you see, pollution is everywhere. Chare kunda chok varsda, boond pave sehaj subaye, jal hi te upje, bin jal pyas na jaye. Why I am quoting all these things? Because I am just reminding our scientists, our doctors, our environmentalists that nature has given us a rare gift and we should use them optimally. Their misuse invites annihilation. Now, because I am a student of economics and management. As an economic point of view also, one thing I want to share, that our economic paradigm emphasizes control of consumption. This is very important, because the thing which I'm emphasizing, all the scientists also, they need to promote this thing, that our economic thinking, हम जैसे भारतीय की बात करते हैं, we are emphasis control over consumption. The human being, friends, they are mere trustee of the material resources, not the possessors. It is deeply rooted in our belief system that we should be just, we are given the responsibility to protect it, to preserve it. Of course, we use the things what is required. Now we have to, erect an economic model based on this vision. And in a nutshell, I think the message is very clear. Message is that as shown in the movie also, as I could see the different clips also by Dr. Vrinder Garg Harish also, that telemedicine is something very, very important. You see, these are the ways, these are the media through which we can look at the future, we can protect our life in a proper manner. But believe me, we have to link ourselves with the values given by our tradition, and we must respect our nature. For that, we need to follow our scriptures. We need to look at our roots, what our Indian tradition says, and propagate one thing. I am once again underlining, that is, we are trustee and we are not the owner of the precious global resources. With these words, I once again express my gratitude to the organizer for providing me an opportunity to share my thinking, and I'm sure that after this conference, whosoever participating, they are giving a lot of input, they are giving us directions, doctors, medical professions. Technology is, is making our life very easy, but at the same time, we should ride over the technology. It should not be that way, that technology, we use on technology and we forget our value system. And once again, repeating once again, let us propagate the idea that we are here in this life as a trustee. We have to help the people, right, and not misuse the nature. Thank you very much.
Thank you so much, sir, for enlightening us with the quotes of Gurbani. We are very grateful to hear your inspiring words. We are sure that the Jagat Guru Nanak Dev Punjab State Open University will excel under your worthy guidance and leadership. Thank you so much, sir. Now, our next special guest, Professor Jaspal Singh Sandhu, Vice Chancellor, GNDU. He's the Secretary, University Grants Commission. He is the Professor, Department of Sports Medicine, Guru Nanak Dev University, Amritsar. He established the first Department of Sports Medicine in the Indian university system. He is the Fellow of National Academy of Medical Sciences, International Federation of Sports Medicine, Asian Federation of Sports Medicine, Indian Association of Sports Medicine, Association of Surgeons of India. We are very honored to have you here, sir. He will be joining us very shortly. I would like to take the opportunity to introduce our worthy panelists. Dr. J.S. Thakur, Professor and Head, School of Public Health, PGI-MER. He's the Professor and Head at Department of Community Medicine, School of Public Health, PGI, Chandigarh. He's the Faculty in charge of Urban Health Training Center. He's the member of the Institute Ethics Committee and Data Safety and Monitoring Committee since 2012. He developed the proposals for Satellite Center of PGI at Sangrur and Firozpur in Punjab. He's the member of professional bodies and International Epidemiological Association, Indian Association of Preventive and Social Medicine, Indian Public Health Association, Indian Association of Epidemiologists, Indian Medical Association. We are thankful for having you here, sir. Our next panelist, Dr. Nivedita, MBBS, MD Hospital Administration, Deputy Director, Medical and Health Government of Rajasthan. She's a medical graduate and medical administrator. She's an expert on healthcare management, human resource, healthcare planning and policies. She's a healthcare quality advisor for the state of Bihar, Jharkhand and Karnataka. She's working with NHSRC for quality assurance in healthcare. She's also working with NABH for healthcare quality. She has a lot of publications on grievance redressal, QI in healthcare, organizational behavior. She's a soft skill and communication expert in leadership development programs. She's working with Unnat Bharat Abhiyan. We are very grateful for having you here, ma'am. Our next panelist, Dr. Gopal Pathak, Vice Chancellor, Sarla Birla University, Ranchi. He's currently serving as Vice Chancellor of Sarla Birla University. He's the former professor and coordinator of the Environmental Science and Engineering groups at BIT Mesra. He was earlier appointed as a visiting scholar, fellow, professor at the University of Technology, Sydney. He has 14 publications in journals of repute and presented many research papers at conferences in India and abroad. Thank you so much, sir. We are very grateful to have our panelists here. I would now like to introduce our moderator, Ms. Guneet Swani, Director, Human Tech Health Private Limited. She's a proven entrepreneur and business strategy consultant with diverse business experience in US, India, and European Union. She's the Director, Egg Heal Global LLP, Innovative Solutions in the Egg Tech and Affordable Healthcare. She's the Domain Advisory Board, Savera Foundation, a non-profit working in wellness, environment, skill development, and women upliftment. She's the founder and CEO, Stylus Wellness. She's the Director Exports, Swani Rubber Industries. She's the brand ambassador for clothing line by Mehzabeen Pirzada. She's the keynote speaker at the National Skill Development Conclave, and she has been conferred with Distinguished Chandigarh Citizen Award 2018. We are very grateful to have you here, ma'am. And now over to the moderator, ma'am, Ms. Guneet Swani.
Hello, everyone, and namaskar. Good to have you here today. It's a very deeply embedded feeling to be talking about something so close to our heart, which is being taken for granted. Our air, our water, our earth. As Darwin surmised, those who survive are not the strongest or the most intelligent, but the most adaptable to change. The pandemic here is here to teach us in a very significant manner, of course, in a very ferocious manner too, to understand where and how we have lost our values towards our basic air, water, and earth. Let me start with the subject and the word waste, our topic today. It's actually material with much energy, nutritional value, and huge recovery. Let me also expand this to a larger, more pressing issue globally, and definitely more so in India. Let's talk about biomedical waste, biodegradable waste. The disposal management has been around and sees improvement all the time. Our panelists have been in thick and thin of this, seeing it very closely like all of us. And how we as individuals can pitch in to learn our lessons and take this forward and take it and make it a vision with a mission, the biomedical waste. It's the BMW is the need of the hour, with especially the PP kits to the syringes to everything what the pandemic has got upon us and how we are going to deal with it and take it forward. Dr. Nivedita, you have been with AIMS and seen it very closely. It's been very challenging times, I'm sure, for you being one of the warriors too. India has managed the pandemic in a very robust manner, in many ways, but the biomedical waste, the way it rose and the way it has been tackled is phenomenal. But how do we take this forward? Would you like to give your input in this, please?
Yeah.
Yes.
A very good afternoon to all. Thank you, Guneet. As Sakshi very well explained, what is a biomedical waste? Waste generated during the treatment, diagnosis, research, vaccination of the humans or the animals. And this waste is basically, we have heard of like a kind of new buzzword. These days we have heard, even the layman has heard that there are categories in the biomedical waste. The category of the biomedical waste is according to the final disposal of the waste material we generate. Like one particular color as the yellow that goes for the incineration. This is according to that. The categories are not according to what is being generated, but finally how it will be disposed. Like all yellow bags, they will be taken to an incinerator to be incinerated, or many will be recycled in the process. As a developing nation, India has its own, like as other nations do have, we have our troubles in like regulations, implementing the policies and all. And this pandemic, they actually they did show us that where do we stand. We had the biomedical waste rules and policies since 1998 in the force, but nobody heard of those before 2016 when the new rules came in the wake of the new like National Green Tribunal, environmental health and all. And like it became a common feature that there are some rules, they are to be implemented in the hospitals and all. And this pandemic, in the COVID-19, we had the crisis of resources as well as the manpower, because like COVID, it took most of our resources, most of the manpower, and people were scared to come in front and work for this. And as you must be knowing that there was indiscriminate use of single-use mask, PPE kit. Like I have seen people going to tourist places wearing a PPE kit. They are flaunting it, and you can spot the N95 mask in the kitchen garbage, in the residential dump bins. You can see the PPE kit. Like nobody was aware how it is to be worn, how it is to be handled, but they were using it and throwing it. Biomedical waste is entirely different from the general waste, as it has risk involved. That's why it is called biomedical waste. Like you can have injuries due to sharps, you can have fomite related, like the infection, which fomite is one thing which has germs on it. Like an N95 mask, they got germs when we wear them. And if anybody touches that mask, he can get that infection. So people can get infected, handlers can get infected. And finally, this, like all this is plastic, more or less. So this microplastic, it can pollute our rivers, the environment, our soil, everything. So during pandemic, this waste generation went like almost up to 200 tons a day almost. In May, there were days when it was reported 205 tons a day, which was almost 5 times the regular generation of the biomedical waste. And the generation was indiscriminate actually. So we have to limit this. Like who all should be using which kind of protective gear or the mask. Everybody doesn't need an N95 mask. Everybody doesn't need a PPE kit. Like people are calling their household workers wearing a PPE kit to clean the houses, even in my society. And they are throwing this in the garbage, the municipal garbage thing. So during this, this was almost a tickling bomb. Like we were fighting COVID initially, and we were scared that next it might come that biomedical waste generated occupational diseases, nosocomial infections, they will come next without telling us. And we can see the pictures from the oceans, like some sea animal entangled in a mask, or the dogs wearing a mask. So this was indiscriminate. So we have to, like, for a future thing, we have to limit the use of biomedical equipments, you can say, the PPs, disposables, like in quarantine centers, we were using disposables to serve the food. So limitation is first of all. Then we have to segregate these biomedical waste at the source. In fact, in 2020, in wake of COVID-19, CPCB gave few new guidelines as to handle this COVID-19 waste, biomedical waste, and they launched an app through which the generation and the transport, progression, and the final disposal, they can be tracked. Like, they are doing their bit, but it's we, the people working on the ground. We have to enforce these all policies and rules. This can be done by the extensive trainings, teachings, and finally, what works the most, that is the penalties. To dispose this waste, we can, as you said, in the rural areas, we have many infrastructure in place, as we have industrial furnaces, we have cement kilns, we have mobile incinerators. So we can mobilize these existing resources to use this to dispose the biomedical waste in the wake of this COVID-19 due to enhances in the waste generation in the COVID-19 thing. No, I'm not able to hear you, Guneet.
Thank you, Dr. Nivedita. This was great insights to the basics and understanding, and even a great way forward for everyone to understand that this is just not the pandemic, the consequences which we are dealing with, and how we are going to further on enhance ourselves to not go through this crisis again. Dr. Thakur, we all know that there is waste management when we talk about the 5 R's, the refuse, reduce, reuse, repurpose, and recycle. The government has implemented lots of new policies to be implemented post-pandemic. What do you think the strategic aspect here we should look into to make sure that they are implemented in a manner that is more doable and taken forward in an easier manner?
So thank you, Guneet. We have, many policies and programs in this country, but the serious issue is of implementation, right? And when we are talking about biomedical waste, there are certain things which are very critical. The first and foremost is that waste should be segregated at the place of origin. And if you see, this segregation is not happening, especially in the rural area, is a big challenge. Different kind of waste, they are to be stored in the different type of bins. So this segregation is very critical, and sometimes there is mixing of, the biomedical waste with the routine solid waste. Then there are storage issue, as I mentioned, that under the biomedical waste management rules, you have different color-coded bins which are to be used. But these bins are being interchangeably being used. And, our healthcare workers, because of lack of sometimes training, they are not able to use the appropriate bin, and that also lead to the mixing. And also in some of the areas, in smaller institutions in the periphery, that is primary health centers and the secondary health centers in the urban and rural areas, we have, some of these activity of collection of the waste, biomedical waste, is outsourced to the, private agencies. And these private agencies are sometimes not regular. as per the rules, you need to, dispose of any biomedical waste which is generated within the 24 hours. So if somebody is coming, after 3 or 4 days or irregularly, that does not make any sense. And then another issue is pertaining to the transport of the waste, and transport is also an issue. We have seen that even the staff is sometimes asked to take waste in a bag and dispose of. So that is another important problem. And finally, there are many issues related to the disposal. And in disposal, we have seen that you really require a adequate infrastructure to dispose of, starting from incinerator to the treatment for the infectious waste before disposal, and then also some of the sanitary landfills. So this type of structures, we have not been able to create, especially in rural areas. In urban areas, we do have such structures. So although, I would like to say that we have very good biomedical waste management rules in our country, but there are issues and challenges in implementation because of the lack of capacity and infrastructure in some of the cases. We are lucky to work in PGI as a premier institution, and in fact, we are getting award almost every year on Kayakalp. So we have all these systems are available, but we have seen that in smaller hospitals and in rural area, it is a challenge.
Thank you, Dr. Thakur. This was very enlightening, and implementation of appropriate segregation of waste and collection and time management definitely is a challenge we are facing. And yes, with the new policies in place and the penalization probably is going to be the way forward for us. And also perhaps privatization, which is coming into place as well with certain norms, is a ray of hope for us. Thank you very much. Dr. Gopal, what, according to you, is the ultimate lesson the pandemic has taught us as far as the waste, biomedical waste, biodegradable waste management has taught us?
Yeah, very good afternoon, one and all. Am I audible?
Yes, yes.
Yes, so thank you, Dr. Guneet, for inviting me over here and asking this question. So I would like to discuss something very briefly, and then I will come to your point. The rapid industrialization and urbanization has provided humanity with many material and social comforts. At the same time, it has brought in its wake many material and social problems. And it is hardly, though prehistoric many data, and one of the learned speakers said about Guru Granth Sahib and all, and even in Ramcharitmanas, Ramayana, and all other many books, we have found all these things. But modern era, if you are talking about, so the first conference on these issues, environmental issues, was held in Stockholm, the capital city of Sweden, in 1972. And two very important declarations were passed. All the natural resources of the earth, including soil, water, air, should be preserved in a very systematic way. And also one declaration enunciates like, man is the creator and molder of his environment, which gives him physical sustenance and offers him opportunities for intellectual, social, moral, and spiritual growth. And afterwards, the concern about all these things came. As Professor Thakur also said about the implementation issues, if you see our 1986 Act, Environmental Protection Act, many things are covered over there. And of course, many amendments were made afterwards. But implementation part is really difficult in this country, at least till date. Slowly, government is trying to do lots of things. But who will do it? We are the creator, we are the molder, and we all have to do it. As you asked about this biomedical waste, which after COVID-19 we saw the kind of issues we had, and every day this PPE kit and all, here and there in Ranchi city, I observed it was thrown, and when somebody died, even at the cremation place, we saw many those kind of wastes were thrown in a very unplanned manner. Of course, everybody was scared and nobody was ready to touch it. What happens with this kind of untreated biomedical waste? If you go through the WHO report, it's not COVID is one thing, COVID has come recently, 2019, but otherwise also those waste, biomedical wastes, it causes many infections worldwide, like your hepatitis B. So some 21 million infections were reported. Hepatitis C, 2 million cases were reported. Even for HIV, some 260,000, what the WHO says, 260,000 cases were reported due to unplanned way of disposal of or untreated biomedical waste. So now we have many disposal methods. Techniques are known as, some of the learned speakers talked about the incineration, very old and of course a good method. But incineration of these kind of materials causes air pollution as well. So that protection need to be taken care of. Then chemical disinfection, that is also, but on the spot itself, it is done, it is good. If it is transported to some other places, as in case of municipal solid waste or industrial waste, we do it, transported from one place, from the place of generation to the treatment site. So during transportation also, it can spread lots of contamination in the air or water. So the third method, which is wet thermal treatment, steam sterilization, that is also one solution. Microwave radiation, this is again a solution, but I will tell you some negative points are also, as any method, any process has got some positive points, some negative points, disadvantage is also there. And of course, land disposal, deep injection, that is one of the best solution, but every time it is not possible, the availability of land and all. But the technique now, which is being followed in developed nations, because they all suffered from these kind of issues after COVID-19, the typical COVID-19 biomedical waste, if I'm talking about, so they make it inert first, that is inertization. So shredding of all those things, as in composting, I'm just comparing it to how, in composting, what do we do? Even in the rural areas, it is very much applicable and we are doing it. So what is happening? Particle size is again a very important factor for the decomposition. So particle size, for optimum result, the size of the waste should be between 25 millimeter to 75 millimeter. So that is the optimum size. The bio shredding, we do it. Then seeding and mixing. The time can be reduced. The biodegradation time can be reduced if we can mix some of the compost 1 to 5% by weight. Then when the process is going on, even for this PP kit, same should have been done, mixing and turning. And air requirement, because this is going to be an aerobic digestion, so oxygen will also be required for that. So optimal conditions, if we can create the disposal of this kind of biomedical waste, could be done comfortably. As I told you, for the rural India, I was talking with Gulin few minutes back, I should say, or 1 hour back. And she was talking about the disposal of waste or biodegradable waste in the rural India. So composting is one of the best technique they can adopt. But for that, the materials need to be separated first. As we know, the 6 functional element of any kind of solid waste management, whether it is municipal waste or industrial waste or hazardous waste. What happens? Firstly, we have to calculate the generation, how much waste is being generated. Then it is collected at some place, then it is transported to a different place at the site of treatment. Material could be recovered also, and energy could also be recovered. Methane gas and all that is anaerobic decomposition. And those gases could be recovered, those gases could be reutilized. And finally, we have to go for final disposal. For city, no doubt, the sanitary landfilling is the most engineered system, well accepted system all over the world. But sometimes so much land is not available. So rural India, we go for composting. There also, as I said, the size of the particle and other things need to be done. And as far as biomedical waste is concerned, which is a major issue these days, we can go for innertization and then for going for final disposal. It will reduce. Okay. Any question? Did you? So that is the best way to dispose it off. And deep injection, if it is possible, we must go for deep injection. That is one solution which could be done. For again, the land and all would be required for that. That is sanitary landfilling, same thing we do. But in most of the cities, we are not finding. In Ranchi, we have a site, is a capital city, but landfilling, we are again. So I think I have expressed my views. Any question or anything anybody can?
Thank you. Thank you, Dr. Gopal. This is a great conversation, and learning from all this and with all of your inputs, we have definitely come to the conclusion that the major concern is the lack of support of segregation, effective waste management, starting from a basic rural household level, going up to the medical level. How do we tackle and how do we take this, and of course the segregation of bags, the color coding. There is much training and challenges which we are experiencing from urban area to the cities, and with resource management. So privatization and the government support, of course, is very, very much here. My take here is to all of you that, of course, we don't have much of a challenge in the rural area as far as the biomedical waste management, BMW, is concerned. We have the challenge of biodegradable waste, which is also quite challenging. And if we can start from the rural areas and we go upwards, probably it might be easier for us to tackle this situation. Of course, there is lots which is going on the government policies and robust way forward into the biomedical waste management. Let's talk about the biodegradable management at the rural aspect and areas. So, what is your take on it? How do we take it forward, and what do you think is the need of the hour in this aspect?
Rural India, as you said, here also, firstly, we have to see, like in a village, just imagine a village of 200 families or say 1,000 persons residing in that small village. Firstly, the 6 functional element of any waste management, the first functional element says how much waste is being generated. That is biodegradable waste. Of course, other waste like papers and cardboard, etc., plastics, rubber, etc., they should be there. So, as in the cities also and in the villages also, if 2 bins we can keep in each house, the grey bin or blue or whatever, any color you can choose. So, if that is separated, the biodegradable waste are separated, and the waste like, as I said, garbage, your paper or cardboard or bottles, glass, etc., waste, those kind of waste are also there in all the villages now. They are also getting advanced slowly. So many those kind of stuff would be there. But biodegradable waste need to be segregated. And as I told you, the best system for rural India would be to go for composting. Otherwise, what do they do these days? Open dumping, that is a common fashion or common way of living. 1 kilometer away from the city or from the village, the dog, they simply dump it. But open dumping is a very practiced system in India. In villages also you will see, and finally they will burn it. But once the waste is burned, lots of air pollution would be there, the fuel, etc., etc. So that is not a healthy way of waste disposal. So composting would be the best thing. One site could be selected, and as I told you in the beginning, for to get optimal result in composting process, the particle size is a very important factor. So shading need to be done, because for optimum result, we have to, the size of the waste should be between 25 to 75 millimeter. So that should be cut, whatever the waste we are getting. Then, as I told you, seeding and mixing. If 1 to 5% of compost could be made, the process could be more faster and the result could be better. Mixing of compost, turning time to time, if it is turned, the process is fast and the result is again better. Air requirement, as I had mentioned earlier also, because this is an aerobic method of aerobic conversion, so oxygen is a must. So at least 50% of the initial oxygen concentration should be there, and it should go to the all parts of the compost. Moisture content, again a very, very important parameter. The 55%, if additionally also some water need to be sprinkled, 55% of moisture content need to be maintained to have a optimal kind of result. Then temperature also is a very important parameter. So between 55 degrees centigrade to 60 degrees centigrade, if the temperature is maintained. Village, they can do it. They are comfortably, they can do it, but somebody has to monitor it seriously. And in village also now education is there, and the government, the way government is taking steps and all, I am sure. Sometimes for rural India, whenever I took any project on water issue or air issues, I saw 2-3 persons at least they know in the village, and I always deputed them to take care of their own place. And I told them self-help is the best thing. Don't wait for the government to come. They will not come to your house and do it. Of course, the policy is there, but implementation is tough, as Dr. Thakur also said. So carbon nitrogen ratio, that also need to be mentioned. So if it is the ratio is 30 to 50, we can get optimal result. pH also, pH value is again an important factor. It should be close to 8.5. If the government deputes somebody, some technical person, means at least he should have some idea of science, some chemistry, basic chemistry. He can take care of those things. And if this is the way the composting is done, the waste issue will also be solved, and the compost could be used for farming to have better crop in the region. But and the second one, if we go for anaerobic conversion, we can generate methane also, and the gas could be utilized for burning the light in the street, in the house, and for other purposes. As we have seen, government had implemented earlier also this cow dung they used to do for villages, and that is gobar gas we call. And in villages of Punjab, it was very popular. At some stage, I don't know these days what is the situation, but those plants, villagers or the kisans, they had installed in near their farms or near their house, not of course near their house, and they used to use methane for burning the light in the street, for burning the light in the house, even for cooking purposes. They were not dependent on the cylinder, the gas cylinder, what we get in our house and all. So this cow dung plant also worked very well, and even today also it is workable. Only need is the desire. There is a will, there is a way. So a team they can make. I had taken up some projects sponsored by UNICEF, also in villages. There the ladies, they took the lead role, and I tell you, they really succeeded. One of the villages of Jharkhand, the project I had taken up, funded by UNICEF, and it really worked well. So a group was formed because ultimately what happens? Who is going to monitor all these things? You have given them the ideas. Implementation, as Dr. repeating again, I am what Dr. Thakur said, implementation, sometimes we find it very difficult. So for that, we have to make either some NGO can take it up, means committed NGOs, not only in formality, they should not do it. Or otherwise, ladies of the villages, I saw, once they took the lead role, at least one village I remember even today, they took the lead role. And they were convinced, like, after all, they are taking care of the family, they are the homemakers for their husband or health of children. So they are more concerned, as I observed, as compared to father. Mothers were more concerned. And they took the lead role and they could contribute significantly to the society. So this is the way we can proceed. I tell you only two things to be we can put focus on: your composting and this gas generation, and using the methane gas for burning the street, for burning the light at homes, or even for cooking purposes. So this way we can proceed. Thank you for the wish.
Most welcome. Thank you so much, sir, for such valuable inputs due to your impeccable expertise in academic and administrative field, wherein you have published and presented many technical papers in various national and international journals, and also presented papers in various national and international conferences in places like China, Switzerland, Sweden, Finland, Australia, Iran, South Africa, USA. We are really thankful to you, sir, for such valuable inputs.
Thank you. Thank you one and all. Thank you so much. Can I exit? Would you permit? Or should I? Whatever you say.
Yeah.
Because I have many meetings scheduled already. So thank you.
Thank you so much for your valuable time and input, and look forward to many more conversations. And
Surely. Surely. Thank you. Thank you.
By team as well. Thank you very much. We shall take it forward with the other panelists.
Guneet, I would like to add a word.
Sure. Please do, Dr. Vivek.
As sir said, biodegradable waste, composting and all. Basically, I would like to emphasize that biomedical waste is totally different from the biodegradable waste. Okay. Yeah, actually, as you said, there are 5 R's. Okay. First of all, reduce, definitely. I would like to emphasize on reducing the waste generation by, as I said, judicious use of the biomedical equipments. Okay. Then is reuse. We cannot permit reuse when it comes to biomedical waste. There is no place of reusing it. In fact, we as administrators, we are fighting this issue. As we send the things in red bags, that is a plastic thing that goes to disposal site, and this is after shredding and all, and this plastic is taken out of that waste to be used in the some industrial purposes like dustbins, road makings. You must have heard of they are mixing plastic in the concrete to make the more sustainable waste and to reduce the waste load. The next, as I said, recycle, that is not possible, especially the incinerable waste that goes in yellow bins. That is human anatomical waste, mostly the organs, like amputated body parts, something taken out of the operation, blood-soaked, body fluid-soaked bandages and all. They cannot be fighted with this only the disinfection and composting and all. They have to be incinerated after disinfecting them with microwave, autoclave, whatever method, or the chemical disinfection. But after that, you have to burn that to the ashes. Definitely, this I agree. This adds the burden on the environment. But when we have to choose between two, like the direct infection spread and some carbon particle, then definitely we would go for this incineration thing, because this is almost like you say we say utilization kind of thing. When we buy some equipment, we see its utilization, but when it's critical care equipment, We don't go by its utilization. Like that, if it is life-saving equipment, then it becomes redundant. So when it comes to source of directly spreading infection thing, like the yellow waste, then after disinfection, it is incinerated. Like, I don't think the composting will be helpful in that. So maybe like biomedical waste and the biodegradable waste, like as sir said, ki composting, deep pit, garbage site pits and all. I am a bit skeptical, like how far they'll be successful.
Biomedical waste management is totally different. As she said about the rural India, the biodegradable waste, that is the food waste and all. So for that, composting we can do. This biomedical waste, they are really very dangerous, and the treatment need to be very, very different. So they are totally two things apart. Means miles and miles apart. We cannot compare those two things. Like what we get in biomedical waste, of course, we focused on PPE kit and all during this COVID-19, but otherwise also culture, we go for urine culture or other kind of things. So those waste from operations, autopsies on patients, what we do in the hospital, then tissues, waste originating from infected patients, the kind of waste. So they cannot go for composting at all. Composting is only meant for the food waste and all. And then waste having come into contact with infected hemodialysis patients when they go on dialysis. So those kind of waste, they are very dangerous. And I told you, for their treatment, a very separate method, including the PPE kit and COVID-19 biomedical waste, either incineration or chemical disinfection. It varies from the type of waste. Chemical disinfection, it also works, but incineration would be needed for those kind of PPE kit and all. Then wet thermal treatment is also done. That is also one technique which could be applied for biomedical waste, not for general type of municipal waste or biodegradable waste. So biomedical is totally different. Microwave irradiation is again a technique which could be adopted for handling biomedical waste. Then our land disposal, I said you, deep injection. So, but deep injection also is objectionable at times. They can pollute, they can contaminate the soil also, and even the water body, water table, they can also reach up to. So that is also objectionable. Inertization, which I said, they are made inert first. That is another technique which these developed nations, they have adopted. In 2020 also they have adopted. They try to make it inert, that is a technique, and they finally dispose it off. Composting should never be compared for this biomedical waste. Is totally different. So that was my view. I think there was some communication gap, or I could not explain this properly. So biomedical waste, biodegradable waste, totally two different things. And the management is also very different. Okay. Thank you.
We started with waste, and we eventually captured all the entire nation. We wrapped it up, taking from here to the medical waste, to the urban, to the rural, and that's how we try to just enhance it more, because with your expertise in so much, why not add this too for the rural India? So waste, as it is, rather than the end of pipe approach, the bottom line is to take the waste.
Can I just say a few words?
Sure. Your implementation in this also is very valued.
Yes, so I think the focus of this session is on biomedical waste. So we need to, understand as a audience that we have different categories of waste under the biomedical waste, right? And the only waste which is generated as a biodegradable waste from the hospital is from the kitchen, because you have the dietary services, right? And in this also, as Dr. Gopal has also mentioned, the composting is one of the methods, and you have now disposable composters also. And in fact, we have come up now with the Center for Sustainable Development, Health and Wellness in one of the village near Chandigarh, where PGI and World Density Federation is also participating, and we are working on these sustainable technologies. And one of the method which we are using for this biodegradable waste is that you have these days composters which are available and that can be used for this purpose. One of the things which we have observed in Punjab, that because of this poor biomedical waste management, our natural resources, they have become polluted. And especially from our studies, we can say that the mercury level is very high in the water of Punjab, whether it is surface water or groundwater. And what are the sources of mercury? This is either from the sphygmomanometer or the thermometers. So 80% of our samples, they were having higher level of mercury, which is also taken as a slow poison. In the past and earlier Maharaja's time, this was used as a poison. So because of this problem with our biomedical waste, we have spoiled our natural resources, and that is maybe water, air, and I would say that our soil has become toxic also to some extent. And unless and whatever we are producing, that is entering into our food chain, into our bodies. There are some multi-centric study which we are doing. That is, what are the health effects of this chemical toxicities in Punjab. I have no hesitation in saying that our water, our soil, our air to some extent, and our food chain has become toxic, and even there is some contribution of biomedical waste. It is not only biomedical waste, but this is municipal waste, industrial effluent, they are also doing. So I think this is very important that whatever waste we have, whether it is a municipal waste, whether it is industrial waste, or it is a agriculture waste, all should be disposed of in a proper, responsible, and a professional manner. And for that purpose, the training of the key stakeholders, particularly in rural area, is required if we really want to address this important issue. Thank you.
Thank you, Dr. Thakur. This was great input and very wisely put across about the kitchen waste, which could be inspiring, the compost aspect for the rural India as well. And we have a small clip from rural India in one of our states, Himachal Pradesh, where the biocompost from the kitchen, how it is being used. And starting from there, if we can bring this awareness to every citizen, from a household to a medical practitioner, to everyone regarding waste, from medical waste to biodegradable waste, will uplift ourselves. And each one working towards responsibility towards our Mother Earth and our nation is what we're looking for, is what the mantra ahead is for each one of us. And thank you for some great conversations and profound words, and much enlightenment has happened today for all of us. Very vibrant panel, and look forward to this video. And about Denzel Washington, how he's spoken about, at the end of the day, it's not about what you have or even what you have accomplished. It's about what you've done with those accomplishments. It's about who you've lifted up, who you've made better. It's about what you've given back. How he's sailed his way to success, Denzel Washington. So big thank you to Dr. Garg and his team at CIBioD for uplifting us, for enlightening us, and getting us all into a more awareness zone. I would like to share this video, which is from Himachal Pradesh on biocompost and how we can take it forward too in all the hospitals where the kitchen is concerned, and then bring more awareness to the people who are in our hospitals and are from villages, and we can take it forward and teach them to take it forward to their homes and empower maybe the women in the villages too by using this biocompost, converting into manure and taking it forward. And it's all about waste. The bottom line is the waste. We all taking it forward in each and every way. Thank you very much for all the time and valuable inputs. Have a great day and look forward to many more conversations. We look
Thank you so much, our extremely impeccable panelists for such a wonderful discussion. I would like to now introduce our guest of honor, worthy guest of honor, who is present with us, Shri Jayant Sahasrabuddhe ji, National Organizing Secretary, Vigyan Bharati. He has worked extensively on the social welfare of the society. He is an active member of many national think tanks. He has dedicated his life for working rigorously towards promoting Swadeshi Vigyan in India. The motto of Swadeshi Vigyan movement is to promote Make in India, which will help in making the country prosperous and independent. He is working in the field of science from last 30 years. We are really grateful to have you here, sir.
So, इसके साथ let me add, इस पूरे प्रोग्राम Tech4Seva के जो सूत्रधार हैं, वो जैन जी हैं. तो इनके ही बेसिकली थॉट प्रोसेस से विज्ञान भारती की तरफ से ये इवेंट स्टार्ट हुआ था. 2013 में इसका पहला सबसे पहले 2013 में पुणे में इसका सबसे पहला सेशन हुआ था. फिर 2019 में IIT दिल्ली में इसका दूसरा सेशन हुआ था. वो प्री कोविड एरा की बात है, तो वो सब फिजिकल सेशन हुए थे. ये भी तीसरा सेशन जो है Tech4Seva का, जो सेंटर फॉर इनोवेशन बायो डिजाइन विज्ञान भारती के साथ मिलकर और उन्नत भारत अभियान जो गवर्नमेंट ऑफ इंडिया का है, उसमें ये तीसरा सेशन अब ये यहाँ पे हो रहा है. इसको हाइब्रिड मोड में एक तरह से हम लोग कर रहे हैं. तो जयंत जी, आपका वेलकम है.
So now we move on to our very worthy awardee, Mr. Somveer Anand, Director Innovation Mission Punjab. He is the Mission Director at Innovation Mission Punjab, a private sector-led initiative to support the growth of entrepreneurship and innovation in the state. He is the co-founder of Who Farms and Pint Fresh, two startups in the B2C agri space. At Pint Fresh, he is using hydroponics, cocoa peat gardening, and other high-tech solutions to solve the problems of food contamination and overuse of pesticides. Mr. Somveer was previously with Avendus Capital Private Clients in the United States, where he managed investment portfolios for 30 large US-based families. We welcome you, sir, and now we would like to invite Shri Jayant Sahasrabuddhe ji to kindly confer the award, Excellence Award, to Mr. Somveer Anand.
I congratulate Dr. Somveer Anand for receiving this prestigious award, and I confer upon this award to him. I once again congratulate him. सोमवीर जी आज कुछ पर्सनल रीजन से ज्वाइन नहीं कर पाए. उनको सेशन से जस्ट इमीडिएटली पहले कहीं पे फैमिली ट्रेजेडी में जाना पड़ गया. सो सोमवीर जी की तरफ से मैसेज है कि वो इस अवार्ड को पाकर बड़े उल्लास में हैं और बड़ी खुशी महसूस कर रहे हैं और उन्होंने खेद भी जताया है अपना कि वो किसी कारणवश अपने पर्सनल कारण के साथ यहाँ पे ज्वाइन नहीं कर पाए। तो हमारे साथ डॉक्टर विवेक कुमार जी, ही इज प्रोफेसर एट IIT दिल्ली एंड वो टेक4सेवा में को-कन्वीनर भी हैं। जयंत जी के साथ डॉक्टर विवेक जी भी इस प्रोग्राम के सूत्रधार हैं, जिन्होंने स्टार्टिंग से करीब 3-4 महीने से हमारे साथ लगे हुए हैं। डॉक्टर जयंत जी IIT दिल्ली के CIBioD डिपार्टमेंट में प्रोफेसर हैं और इनको काफी लंबा रिसर्च और डेवलपमेंट का एक्सपीरियंस है। डॉक्टर विवेक जी ने IIT रुड़की में भी टीच किया है पहले, बिफोर ज्वाइनिंग IIT दिल्ली, एंड ही इज आल्सो पोस्ट डॉक्टरेट फेलो in 2001 at Applied Science University in Germany, and he is also principal investigator of Indo-UK project. विवेक जी उन्नत भारत अभियान में भी, क्योंकि IIT दिल्ली जो है वो प्रिंसिपल इंस्टीट्यूट है, तो प्रिंसिपल इंस्टीट्यूट होने के नाते डॉक्टर विवेक जी उस टीम में उन्नत भारत अभियान की कोर मेंबर हैं। सो मैं डॉक्टर विवेक जी को रिक्वेस्ट करूंगा कि इस पर्टिकुलर टॉपिक के बारे में वो अपने हम सब लोगों का मार्गदर्शन करें।
Thank you, Professor Harish, and thank you, Shefali, for conducting such a nice session. And I must congratulate all the panelists for highlighting such an important, I would say, concerning issues related to biomedical waste. In our country, as far as discussion around biomedical waste is concerned, is actually started after 1998, when for the first time management and handling rules were published for handling the biomedical waste. But today also we can say that biomedical waste, topic related to biomedical waste, has not found its place in academic curriculum. We look at the curriculum of students studying sanitation and solid waste management. They don't study much about biomedical waste. They mostly focus on MSW, and there is a focus on hazardous waste also sometimes, and even there is an emphasis on C&D waste. But biomedical waste, it is still neglected. But if you look at the very nature of biomedical waste, like MSW, it is also diffuse in nature and it is affecting everyone. Industrial waste is focused one, you can really handle it. But biomedical waste, again, like MSW, it is being handled by a number of people, those who are not trained, those who are not educated. For example, our rag pickers, if it finds place in the disposal sites. I have seen, this is my own personal experience, that I have seen handling even the health workers, this biomedical waste in a very untrained manner. So there is no awareness, there is no, so it's a big issue.
Big challenge.
And big challenge as far as awareness is concerned, as far as implementation of rules are concerned. In both ways we have. There is a challenge, special challenge, because health workers are dealing with this biomedical waste every day. So they have health concerns. We all know what can happen if
catastrophic.
With other kind of waste, mostly it is affecting those who are exposed to this, the workers, sanitation workers. But this is a waste which user is also kind of handling. User in terms of I'm talking about health workers. So it is of great concern. After COVID only, I would say some kind of awareness came up when people started talking about waste being generated, because everybody was forced to wear those masks.
Paranoia.
And then I remember when I started talking about this through our Unnat Bharat Abhiyan platform. So the first thing I talked about, I mean, of course, there were a lot of videos, a lot of information available on how to use mask and which mask is to be used. But then we started talking about how to dispose the mask. And when we started this, even in IIT, I can say, people were just saying that, is it so important a topic to talk about? It is more important to talk about how to wear mask, what kind of mask. But then slowly they realized that yes, this is an important story. Yeah. So recently I just read somewhere, so average generation of BMW from this COVID is around 200 tons. Yeah. A day. That kind of volume we are talking about. We just talk about masks, but PPE kits, and then those rapid antigen test kits. Yeah. All that.
The syringes now with the
Syringes,
vaccination going up.
Yes.
It's another challenge.
So it's a huge challenge in front of us. But I believe that we have just started talking about this, and with Unnat Bharat Abhiyan, with working with PGI, and soon we are going to start a subject expert group in Unnat Bharat Abhiyan. We have a subject expert group on solid waste. Recently we had a discussion with them that we are going to bring this biomedical waste is one of the, and especially for rural areas, it is going to be a big challenge. So with all these words, I just would like to once again thanks to all panelists and congratulate the Tech4Seva awardee for this session. Thank you.
Thank you, Dr. Vivek. Dr. Vrinder is also online with us. So, Dr.
Jane, my only submission is that after hearing all the learned esteemed speakers, that we all should start from ourselves, and we must implement 3 R's on ourselves. That is, reduce the production of any kind of waste, reuse whatever we can reuse, and recycle whatever we can recycle. Because the best way to treat the waste is to produce less waste. So the kind of development we are following is leading to more consumption of resources, per capita more consumption of resources, and per capita more generation of waste. Our Indian philosophy is to synchronize oneself with the nature in such a way that use the natural resources without exploiting, manipulating them, and without producing the waste. Thank you.
Thank you so much, sir. I, on behalf of Team Tech4Seva, Vigyan Bharati, Unnat Bharat Abhiyan, and CIBioD, are honored to have such august and honorable dignitaries with us. I would like to thank our esteemed guest of honor, Shri Jayan Ji, for sparing his valuable time from his busy schedule. Our special guests, Dr. Vivek, Dr. Karamjeet Singh, for such comprehensive talks. Esteemed gratitude to our panelists, Dr. J.S. Thakur, Dr. Nivedita, Dr. Gopal Pathak, for sharing with us their valuable information. A big thanks for our enthusiastic participants. Thank you all for your willingness and involvement in this virtual international summit. Thank you so much. And please join our next session at 2:30 p.m. Thank you so much.